port is a medical device that's about the size of a quarter, and they look like this. It consists of a plastic basin and a silicone rubbery top. In this video, I cover everything you need to know, from what it's really like to get a port to the huge benefits that a port can be for you. Hi, I'm Dr. Brian. Chemo ports have different names in different areas in medical practices. This includes chemotherapy port, chemo port, which is maybe the most common, portacath, or just port. All of these are the same thing. And today I'm going to cover 5 important aspects of what having a chemo port can be like. And it's what you'll want to know if you're considering having one, or if you have one, or you have a loved one who may be getting one. Number 1, what is a port? Well, a port is a medical device, and it's used to deliver medication directly into your bloodstream. These usually are placed right into the chest. There are some older versions that went into the arm, but I'm really not going to talk about those. A port is a medical device that's about the size of a quarter, and they look like this. It consists of a plastic basin and a silicone rubbery top connected to a catheter. The basin or the hub will slide underneath the skin, and the catheter will go into the blood vessel, and it will look something like this. Now, ports can be temporary, that is months, but they can also be really long-term, like up to years. And the really nice thing about ports is when you're done with them, they can easily be removed. It's a simple procedure done under just local numbing medicine that's actually much more simple than having one put in. And in my own practice, I've seen one patient who had a port for 21 years. So they can be there for a very long time. Now, importantly, modern versions of the ports have no significant metal. So you can go through airports without issues. And you can have an MRI, which is exquisitely sensitive to metal. Next, why should you get a port? For patients who get chemotherapy, a very major complaint is the number of needle sticks. Now, chemotherapy oftentimes goes over an extended time period, weeks, months, and sometimes even years. And initially, it might only take 1 stick to get into a vein that's adequate to give the medicine. But after a while, those veins begin to dry up. And pretty soon, those needle pokes turn into 3 pokes or even 9. With a chemo port, that is no longer a concern. 1 poke, 1 stick into the chemo port, and you can give chemotherapy, and you can also do blood draws for your labs. Also, very importantly, cancer patients tend to need serial and sequential CAT scans. That's to follow their tumor or their cancers. Most often, those CAT scans require X-ray dye. If you can't find a vein, then you can't give the X-ray dye. Modern ports are known as power ports, which very specifically can be used to do CAT scans. The third important question is, how is a port put in? Well, a port is a very minor medical procedure. It's done as an outpatient, so you do it as an outpatient where you come in on the same day and then leave. Usually you don't eat anything after midnight the night before. When you come in to see someone like me, we'll put an IV in, and then you'll go to the procedure room. In the procedure room, you'll be covered head to toe with sterile material, sterile drapes, and then we'll use ultrasound to localize the big vein in your neck. They can be on the right or the left. After we identify the vein, just below the collarbone, about 2 fingers right here, the skin is numbed. Also, you receive IV medicine, and it's usually the kind of medicine that makes you drowsy and kind of drift off into la la land. On the skin, we make a small incision about that long. And you remember that plastic hub I showed you? This will slide underneath the skin, and then this plastic tube will go into the blood vessel. Once it's under the skin, 3 little sutures are put in, which you don't have to worry about. They'll dissolve on their own. And then to close the outside of your skin, we put medical superglue. And this is what a chest x-ray will show the port to look like. Up top, you can see the little plastic housing I talked about. And here's the tube that goes down to the big veins in your chest. So now what happens after you've had a port? Well, one of the really nice advantages of a port is it can be used immediately. That means a special needle known as a Huber needle goes through the skin in through this little silicone covering. If you end up going to a smaller hospital or an area where they're not familiar with your port, if they use the wrong kind of needle on your port, it can ruin the port and you'll have to have a new one. Afterwards, there's really very little discomfort. Sometimes ibuprofen or Tylenol over-the-counter meds can be used, but not really anything else is required. The skin, it will heal in 7 to 10 days, and once it heals, it's just like all the rest of your skin. Waterproof. That means you can return to full activity. If you have had it on your right side and you're right-handed, you can still do do everything as normal with your right hand. You can swim, you can shower, any sorts of exercise that you can think of. You can lift weights, even upper body on that side. You can do yoga or you can run. The one thing that occasionally I hear is that port, because it's right up here, occasionally will rub on the seat belt, but that's easily padded and taken care of. And finally, one of the real benefits of ports is that although it requires one poke, there is special medicine that you can get either over the counter or by prescription. It's called EMLA cream, or a generic is lidocaine cream. You put a little bit of that over top of the port. You put some saran wrap over top for about 20 to 30 minutes, and then you go to your chemotherapy treatment. When you do that, it numbs the skin completely. They poke through your skin and you don't feel anything at all. That's chemotherapy ports. Thanks for watching. If you're interested in other videos, try some of these on the GI system or diverticulitis. And please don't forget to hit subscribe.